Fibroids are non-cancerous growths that develop in or around the womb, that is the uterus. They are sometimes known as uterine myomas or leiomyomas. The growths are made up of muscle and fibrous tissue, varying in sizes, ranging from microscopic to masses that fill the entire abdominal cavity, and there's often more than one at a time. In some cases, it can be as large as a full-term pregnancy. This condition can affect women of all ages, but is most often common in women ages 40 to 50. Many women are unaware they have fibroids because they do not have any symptoms. Women who do have symptoms, depending on their number and location in the uterus, may experience heavy periods or painful periods, tummy, that is abdominal pain, lower back pain, a frequent need to urinate, constipation, and pain or discomfort during sex. In rare cases, further complications caused by fibroids can affect pregnancy and cause infertility. Today we'll be discussing fibroids, the different types, risk factors, presentation, and of course, management. Stay tuned. It's another day with the physicians where your health is our business and will always be our business. My name is Dr. Martina Agberie, your regular anchor on this program. And with me, as usual, I'm not always alone. I have my celebrity shrink, no other person than Dr.
Memuna Yusuf Kadri. Welcome to your favorite health TV talk show, The Physicians, where your health is our business.
And of course, we will always remain
our business.
Talking about fibroids. So, the risk factors, the complications, the challenges, the types. Something that was very frightening was when I was doing my house job.
That is like 30, 40 years ago.
About 34 years ago. And a lady came in and she was pregnant.
Or you thought she was pregnant?
No, she said she was pregnant.
Okay.
And asked her some questions. Lo and behold, we said that is not pregnancy.
It's fibroid.
She said no, that they told her it's pregnant, that she went for a healing thing and they told her she's pregnant and that is what she's carrying. Examiner said she's not pregnant. It's fibroid. She was like full term.
Like 9 months,
yes,
carrying a big. I know the thing again, with time, or rather over time, I now can relate to when people say somebody was pregnant for 2 years, 3 years. I'm like, that is fibroid. There's no pregnancy. No, see, after 9 months, there's already an issue when the baby passes the 40 plus 2 weeks of gestation. So I can just think back of when you start hearing those somebody was pregnant and then now eventually get to the come and give testimony, yes, and say yes, finally I've delivered, which it was fibroid, they just removed it and you are not better. It now looks as if you delivered the baby, because yes, some of, like what you just described, some of them can be as big as even twin pregnancy. Yes, even some of them, like I don't know if it's a myth now, they will tell you the reason why you have fibroid is because the womb. Yes. The womb. He said no. He says a space. If there's a space, something must occupy that. Go back to our 40 teacher. No. Something. I'm coming. I said something. You know that statement. I know. Good girls something must have babies. Bad girls don't have babies. No, bad girls have babies. Good girls have fibroid. So they say something must occupy that space. So I say yes, something must occupy that space. When it's devoid, something must be there. Understand? So when you have fibroid, take it is fibroid. Yeah. Fibroid does not become a baby. No. There's no. It can't even be. It's not. There's no similarity there. It's fibroid. It's baby. It's baby. Period. Well, we have an expert coming to discuss more on fibroid. A whole lot of myths about fibroid. Is it possible to be pregnant when you have fibroid? Do you have more than one fibroid at a time, or is multiple? Is it as a result of crossing a path? That is why you're having a fibroid. We'll debunk all that will become on our program, The Physicians. Don't go away. We're back after the short break. Stay tuned.
Every day and in every way, enjoy that I find support. No matter the role you play, you supplement for you and me. In your body,
Darabite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darabite from LB Pharma. Darabite. Love yourself.
Welcome to your Health TV talk show, The Physicians, where your health is our business. Today we'll be discussing fibroids, the different types, the causes, the presentation, and of course the management. And in the studio with me is no other person that our very, very, very own intelligent, cerebral, the first in all, Dr. Ahmed Ninalowo. He is a diagnostic and vascular interventional radiologist. He has pioneered many procedures in Nigeria and West Africa, including the first endovascular brain aneurysm coiling, first scrotal varicocele embolization, just to name a few. If I have to read everything about him, the first, we won't even end today's program. But I'm happy and proud to present him to you on our program today because he's going to be talking about fibroid. Doctor, you're welcome to our program.
Thank you, and thank you for having me again.
You're welcome. Thank you.
Looking at you like this.
Coming back again.
With all
It looks like you want to get into the theater.
Yes.
We're ready to
I am going into theater.
honestly. So we're not talking about fibroids, so we'll let you go. Thank you for coming again on our program. Talking about fibroid, what are fibroids? Just give a general overview.
So good question. So fibroids are, every woman has a womb. You're born with a womb, and as you grow older, the womb gets a little bit bigger, right? And the womb is basically where the baby sits, obviously. And fibroids are smooth muscle tumors that grow within the womb, right? They are non-cancerous tumors, and we know that they are non-cancerous tumors because we've seen them in a lot of women. But they are nuisances because they just grow, and we don't know why they grow or how they grow. They just grow within the womb. And unfortunately, they grow more in black women, right? So women in Africa generally have more fibroids than our white counterparts, right? So they're just a complete nuisance. It's a smooth muscle tumor that's not cancer, but can cause a lot of trouble for a woman and can significantly deplete a woman's quality of life.
Is there a reason why that should happen? Like the possible, among the black women, possible risk factors?
I think it's, quite honestly, I think it's genetics and the fact that we're just generally more fertile, right? Because we know that there's a correlation between high fertility rates and fibroids growing, right? Which is why when a woman goes into menopause, then fibroids stop growing because all of those hormones that we're used to are not there anymore.
Okay.
So now we are understanding this kind of risk factors and all that. Are there different types of fibroid, and what are the causes?
Yeah, absolutely. There are different types of, there's only one type of fibroid. All fibroids are smooth muscle tumors. Okay. However, there are different locations that fibroids can be within the uterus, right?
Okay, great.
And the location of the fibroid would then determine what type of symptom the fibroid causes. So for example, if you look at the uterus, right? Okay. So the uterus is a smooth muscle organ. And then in the middle, we call something called the endometrium, where, the period forms, and that's where a baby sits, right? So if a fibroid is very close to the endometrial layer, right, those fibroids can cause a lot of bleeding, right? If they're within the muscle or on the outside of the uterus, they cause a lot of pain, right? So the location of the fibroid would then determine what type of symptom you get from the fibroid.
Okay, so let's talk about the different types, right? And also depending on location and how it affects pregnancy.
Correct.
Yeah.
Okay, so you want to tell us the different names, then if it's on this location, how will it affect pregnancy? Is it also a cause of infertility?
So the first thing I always tell women, because a lot of women present to me and they say, I have fibroids. And the first question I always ask them is, what are your symptoms?
Yeah.
And you can have fibroids and not have symptoms from fibroids, right? And you can also have fibroids and have a baby normally, and the fibroid would not cause infertility. So not all fibroids cause infertility. However, we know that there are specific fibroids that can result in infertility. And those are those fibroids that are in the muscle layer that are very close to the cavity or comes close to that cavity layer where a baby would implant normally or where the egg would implant, right? And even if you're able to then get pregnant successfully, if there's a big mass where a baby would sit, it would inhibit the baby from growing normally, right? And that fibroid can also then cause the pregnancy to terminate prematurely. So those are what we call submucosal fibroids, right? And then there's something called intramural fibroids, meaning within the muscle of the uterus. And then we have something else called subserosal fibroids, which is just under the layer on the outside. And then there are these monsters also called pedunculated fibroids, meaning they are hanging off of the uterus, but then they are basically growing outside of the uterus.
Wow. So what would the presentation, what is it like? Is it just heavy bleeding? What are the things that the woman will know?
Interestingly, most of my patients present to me with heavy bleeding, right? But there are also patients that don't have heavy bleeding. They have things like abdominal bloating, constipation, urinary frequency, because the uterus can be so big and the fibers can be so big that they are sitting on the bladder, right? And if you think about the way the bladder works, the bladder is supposed to fill up like a balloon, and then you should feel the urge to urinate. But if there's a big fibroid sitting on that bladder, right, that bladder cannot fill up like normal. Once it fills up a little bit, you feel like you want to urinate. So you see those women that are basically in a movie theater and they have to go out about 4 times, that may be a symptom of fibroid or a urinary tract infection. So heavy bleeding, constipation, urinary frequency, leg pain can be a symptom of fibroid, where a fibroid is actually sitting on one of the nerves and it's causing pain in your legs, right? Pelvic pain, right? Significant pain during your periods. There's some women that have so much pain during their periods that they can't even go out during their periods. And we talk about the women with heavy bleeding. And then pain during sex is also a symptom of fibroid. And there's another thing, and maybe we shouldn't get into this too much, but there's something called adenomyosis and endometriosis, which is also a spectrum of things that happen in the uterus that may be mistaken for fibroids sometimes. So again, it's important to get properly evaluated so you could get a proper diagnosis.
I think the endometriosis thing, we'll have to take it as a topic on its own, because there are quite a number of people that can't understand why some people are not having babies, and why someone will say, look, I'm just taking up my womb, I'm just tired, the pain is just too excruciating, so I won't mix it up with fibroid. Now let's talk about some of the myths that we've heard about fibroid, and if you can help us, clarify with the facts. Some people say, once you are pregnant and you also have fibroid, let the woman have her baby. There's no way, don't touch fibroid when a woman is pregnant, because there's a possibility she may bleed to death. Is that a myth or a fact? Well,
most people should not take a woman who is pregnant to surgery during pregnancy, right? To remove a fibroid, right? So if a fibroid is already there while you're pregnant, most gynecologists will leave that fibroid alone and see what happens.
So at delivery, is it better for CS or normal delivery?
Well, it depends on the location of the fibroid. So if the fibroid is sitting somewhere where the baby will come out from, then obviously you do a CS. And there's some gynecologists that would also recommend that you have a fibroid operation when you're having your CS. Yes. So they'll take out the baby and to take out the fibroid.
What about the fact that fibroid grows back?
Well, so we have to take that statement very, very carefully, because a lot of people say fibroids grow back, and fibroids do grow back. The question is, okay, so let's say you have 5 fibroids within your uterus, and you go to surgery, and they remove 3 of them, right? 2 of those that are small can continue to grow, right? However, the most important thing, and a lot of women ask me this, what are the chances of my fibroids coming back? The chances of your fibroids coming back really depend on your age. So for example, if you're 30 years old and you have fibroids and they remove those fibroids, you still have about 22 years before you go into menopause. Your hormones are still very good. Your uterus can form new fibroids, right? However, if you come to me when you're 45 and you ask me what are the chances of my fibroids coming back, I think if we treat you now, the chances of your fibroids coming back are very low, because you're close to menopause. So this is why you've seen so many women that have gone to surgery or have gone to procedures for fibroids, sometimes 3 or 4 times, which can be quite debilitating.
Is that the reason why they say when you go for fibroid and you are still younger, they say, look, and you are married and you are waiting on God, they say, look, now we're taking the fibroid, quickly go and get married. Quickly go and get a baby rather. Because the fibroid don't occupy this space.
Yes, well, that's part of it. I mean, we have a society that puts a lot of women under a lot of pressure.
The pressure is too much.
And it's a good thing you're a psychiatrist, so I mean, we shouldn't be putting women under that type of pressure. But generally, if you get the fibroids taken out and your womb is nice and clean, at that time it's probably a good time to try pregnancy if you're looking to get pregnant.
Okay, so now still talking about fibroids. At what age, what is your recommendation for young people to do investigation? What is your recommendation? Because some young people, some parents will tell young ones, if you don't get married before this time, fibroid is going to come. and you will not be able to get pregnant. So what is your advice? That is number one. And number two, you also have the men saying, no, this one that has passed this age, the next thing, fibroid will grow and baby will not be able to come. So it's actually a challenge, like a social thing for the females.
Yeah, so I mean, I think, you know, we have a society that obviously stigmatizes a lot of things, unfortunately, in Nigeria. But, I mean, there's no guarantee that any woman will get a fibroid. Let's put that out there, right? So if you went to, you know, a junction here in Lagos, and you screened every woman that was between the ages of 25 to 50, maybe about 40% of them will have fibroids, right?
40%?
Yeah,
That is
it's quite high.
That's
Right?
It's high.
Right. But then, not all 40% are going to have symptoms from fibroids.
Yeah.
Right? So it's important, right? So, interestingly, there are no specific guidelines that say you have to screen a woman for fibroids.
It's not a
Right.
routine investigation.
It's not a routine investigation, right? Some women get screened as part of their annual health exam where they know they have fibroids. Because I think it becomes dangerous when we start screening people for fibroids. Because when you start screening people for fibroids, then people that shouldn't be getting treated
Will be treated.
will start getting treated, and we get more complications from treatments, right?
Okay.
As I said, a lot of women present to me and they say, I have fibroids. I've seen you on social media and I want you to treat me. I say, well, what are your symptoms? I don't have any symptoms. Well, I'm not treating you. You know, because what we're treating are the symptoms that fibroids cause, not the fibroids themselves.
Okay. So now talking about what you're treating is the symptom and not the fibroid itself. So at what point do you not treat the fibroid itself? What are the treatment modalities?
Absolutely. So my biggest question when I ask women is, you say you have a fibroid, okay, what are your symptoms? When they tell me the symptoms, I said, is this symptom having a significant detriment of the quality of your life?
Exactly.
And that's a big question. So in my profession, I get to meet a lot of women and talk to a lot of women, and there's a lot of depression because of fibroids and the stigma that society puts on fibroids, right? We have women that when they're on their periods, they can't go out at all.
You are right. They
They
will
just
get
stay
admitted.
in the house, right? Because they are bleeding so much that they have no energy. I've had a woman walk into my clinic, and I'll tell you why. She walked into my clinic. She'd had fibroids for years. She'd been bleeding a lot. They've offered her surgery for years, but she would not have surgery because she was so scared. Walked into my clinic and just fainted. And she was sent by a gynecologist because he had talked to her multiple times to have surgery, and she refused to have surgery. And we had to do a procedure for her that same day, right? So the important thing is that there's a lot of technology now, right? And there are a lot of treatment modalities that are available to treat fibroids.
Okay.
So traditionally, what we have is surgery, right? Open surgery, where they open you up and they go take out the fibroids.
Okay.
There's also something called laparoscopic surgery, where they put in ports, and that's more minimally invasive. But in the Western world, we now have these crazy treatments that are much more minimally invasive. One is something called HIFU, high frequency focused ultrasound, which is also even available here in Nigeria.
Really?
Yeah.
What we offer is something called uterine fibroid embolization, and we pioneered this procedure in Nigeria, and we've offered it for over 500 women now in Nigeria, right? And what uterine fibroid embolization is a non-surgical treatment for fibroids. And the way we do that is we go into an artery in the wrist now, and basically it's like putting in an IV line. And we put in a catheter, and that catheter goes all the way down to the vessels that feed fibroids. And basically, we're turning that catheter until we find the vessels that are feeding the fibroids. And when we find those vessels, we then inject these particles. They're called embospheres, and they're designed specifically for this purpose. And what those embospheres do is basically they block the channels that basically feed the fibroids, the vessels. And remember, anything in the body that can't have oxygen or can't have blood will die.
Yeah.
So essentially, if you starve the fibroids of blood flow, they start to die, right? And this procedure will take me on average about 30 to 40 minutes in most women. And we're done. So interestingly, in America, I will send my patients home 2 hours after the procedure. In Nigeria, I keep everybody overnight, right?
Why do you have to do that? Why do you keep them overnight?
So it's interesting. It's a cultural and societal thing. So in America, we also have emergency rooms that if a patient has too much pain at home, for example, they can go to an emergency room. But in Nigeria, we don't have those services readily available. So I think it's comfortable to just keep everybody overnight, control their pain, control their emotions, and then the next morning they go home.
So this is why this question, I think I need to ask you about this question. How do factors such as severity of symptoms, size of the fibroid, and patient's age influence your choice of treatment?
Very good. So severity of symptoms. So if you have a lady that's having heavy bleeding, for example, we know we can almost guarantee that when we do fibroid embolization, the heavy bleeding would stop. We can change the quality of life of that person significantly, right? Now, the size of the fibroid does matter, right? And it's very important that we set expectations correctly. So if I have a woman that comes to me and she looks like she's 6 or 9 months pregnant, she has a very big fibroid, I always tell those women, uterine fibroid embolization is not the best treatment option for you. The best treatment option for you in those situations is surgery. Because remember, with uterine fibroid embolization, what we're doing is we're stopping the blood flow to the fibroid and we're letting your body get rid of the fibroid to shrink it, right? But if something is so big, your body cannot shrink it. But you know, there are women that, even when you give them that advice, and I always send these women to gynecologists first and say, you must talk to a gynecologist. They're so scared that they still would not have surgery. So some of those women will still offer them fibroid embolization, at least to stop their bleeding, right? And noting the expectation that we cannot significantly decrease their bulk.
Okay, so let's talk about the preventive measures of fibroid, and the possible complications. Complications if you have fibroid and not have treatment, and other complications if you have treatment and it grows again. What are the possible things that will happen? And what are the preventive measures?
So a lot of research has been done on fibroids. And, you know, unfortunately, there's not one thing that we found in medicine that says you do this and your fibroids won't come back. There's no doctor that can. I know you hear about a lot of herbs being sold, right, by people that sell herbs and say, if you take these herbs, your fibroid will shrink. So if you look at these herbs that people take, right, and some of these herbs actually work, and I'll tell you why they work. So there's a drug in medicine that we can give a person, and it basically feels like he went into menopause, you stopped ovulating, right? And when we give that shot, a lot of women that have heavy bleeding will stop bleeding or the fibroids will shrink, right? And what that medicine is doing is basically decreasing the hormones, right? So a lot of these herbs probably have the active ingredients in the same shots that we give. But we know that when we stop that drug or we stop those herbs, those fibroids actually go something gangster, where they get angrier, right? And they even grow faster and faster. So there are really no preventative measures as to fibroids. Basically, when they occur, we treat them.
Okay, so possible complications?
So the possible complications from fibroids, so obviously, heavy bleeding and anemia is a big thing, right? So a lot of women that have fibroids are anemic, they have low blood levels, they have low energy levels, they can't go about their day normally. When fibroids are very big, they can cause complications such as sitting on basically something called your ureter, where the ureter is where the urine comes from to the bladder, right? And they can cause your kidney to go into kidney failure, right? Fibroids can be sitting on your rectum where you are constipated, you're not pooping normally like a normal person. They can infiltrate a lot of things. So the complications are typically the symptoms that they cause, but quite honestly, most fibroids, again, are benign tumors, benign meaning non-cancerous, right? Over 99.9% of them are non-cancerous and they will never turn into a cancer.
Wow. So your final words to our audience when it comes to fibroids.
So I think
women and of course the men that are
support them.
So I think the biggest thing is that, you know, for most women with fibroids, it's important to know that you're not alone. A lot of women have fibroids, right? So, you know, a lot of your friends have fibroids. As a matter of fact, a lot of women that I talk to that we've treated, our biggest referral base are our patients because they see that they've had a treatment that is safe, not surgical, they didn't have any complications, then they refer their friends to have a treatment. So the most important thing is that you're not alone when you have fibroids. Number two, not all fibroids need treatment, right? So because you have fibroids don't mean that you need treatment. What we treat are symptoms, so you have to be symptomatic from your fibroids before we treat fibroids. And then for the men, you know, we can't stigmatize our women. Fibroids are a medical condition, right? We could also have a medical condition that, you know, women need to support us. So when women have fibroids, we need to be in support of them and help them seek treatment appropriately.
Thank you very much, Doctor. And you have actually schooled us. And the part that got me excited was the fact that you are able to do this surgery, right? Non-invasive procedure. Non-invasive procedure. Are you able to do it? And the people just go home. We look forward to when you do it and they will go home and not spend 24 hours. Yes.
No, we've had some women that have gone home the same day in Nigeria.
We'll get there, okay? So thank you very much. I really appreciate it. And we look forward to having you again on our program. And to have just out there, you have heard it from the doctor. Fibroid is non-cancerous. So don't be afraid. Mothers, women, those who have fibroid, Don't be afraid that you have cancer. It's not cancerous, and it can be managed. You've also heard from him. There are procedures that can be done without even going under the knife. It's easy. Just prepare yourself. Ask questions. You are listening on the physicians. You can go on our website and go over this program again if you have to refer a friend to listen more and know what to do about it, how to manage. If you have all those bleeding things, it's not all fibroids that must be operated on. Not all fibroids. Then for infertility, you say, I have fibroid, that is why I'm unable to get pregnant. It depends on the location. All we need is seek medical attention. Go to your hospital. They will investigate. If it's the one that needs a procedure, it will be done. If it's the one that is not going to affect conception, all well and good. On this note, I just want to say thank you for being part of our program again. My name is Dr. Martina Agbemi. Till next time, stay blessed.
Thank you so much, Dr. Ninalowo. That was such a brilliant, breakdown to which is very common, right? That fibroid is in our environment more among the black women than the Caucasians. But now that surgery can be done very minimally without blood flowing, and then asking for at least 4 pints of blood before you get into this surgical room. Thank you so much once again. To all our viewers out there, you are not alone. That's what the doctor has said. If for any reason you have these symptoms, or you know somebody who has these symptoms, we cannot do this operation you've had as if it's out of space. You have to book a ticket, get visa, fly out, do the operation, stay in the hospital. So much money. Now you can do that procedure right here and go home that day if you want to. But if highest, the following day you go home. And for our dear men out there, please be allies to the women in your lives if any of them is experiencing this. It's not the time to tell her that, oh, other women are there, why are you behaving this way? Please be kind to them and extend that kindness to everybody around you, including yourself, because you are also someone. Be kind also to follow us on all our various social media platforms, and if you want to be like Dr. Ahmed Ninalowo, right? Please just go to our website, fill the form, and you'll be right there to share your experience, to talk to all our audience on any health matters. Until next time, my name is Dr. Memuna Yusuf Kadri.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite. Love yourself.